Good afternoon, everyone. I'm Dr. Rohan Khandelwal, and welcome to this session where I'll be talking about the new super specialty pattern and how to prepare and what initiatives is Marrow taking to help you out during this phase. Now, I know it was a shocker for everyone when the prospectus was released a few days back, and rather than a more progressive model which was focusing on more super specialty content, they've gone back to the old model which was there in 2017, where they have given more focus to general surgery. Now, it is particularly discomforting for those who were preparing for subspecialty based exams for the last year or 2 years. But it's also an opportunity for freshers because they will be fresh out of their post graduation, and they will be well versed with the general surgical aspects, and it's a good opportunity for those students. So before I talk about the preparation and how to go about it, just briefly going over what important changes were there. So the exam is scheduled to be held on 13th and 14th November. And these are the dates when you can fill out the forms and you can edit your forms. So this exam includes all the institutes barring the central institutes, that is AIMS, PGI, JIPMER, NIMHANS, and Sri Chitra. So, especially those who would be preparing for the last 2 or 3 years, you people need to take a very strong decision regarding your preparation, whether you keep on preparing for the Central Institute exams and this should be your focus, or whether you want to change course and you want to focus more on the NEET exam. I guess for freshers who are just out of MS, it is a good opportunity in NEET, and you should strengthen your general surgical concepts in the next 2 months and try for NEET. So the eligibility criteria is anyone who's passing their post-graduation by 30th November 2021 will be applicable to give the exam this year. Now, this is the major change. They have made the primary feeder specialties. So there are 13 primary feeder specialties. And if we talk about surgeries, general surgery is one of those primary feeder specialties. So in the surgical group, and my discussion will be predominantly regarding surgery. Medicine, of course, you can reach out to Dr. Rakesh and his team, and they'll be happy to help you out. I will primarily be focusing on surgery today. So the surgical group, the feeder specialty is MS or DNB general surgery. And these are the 12 subspecialties which will get covered under general surgery. So if you get a rank, you can choose any one of these 12 specialties. The question paper, and this is the major change, the question paper will be 150 questions for 2.5 hours duration, and they will predominantly be from the primary feeder specialty. So for surgical candidates, it is going to be general surgery oriented. Now, not all questions will be general surgery oriented. There will be questions from subspecialties, but my hunch is that they will not be so difficult as they are asked in the subspecialty exam. I guess one question which all of you should ask yourself, and this is what I asked the other surgical faculties, was that what are the 5 to 10 topics from each subspecialty which a postgraduate should know? And you people should also ask yourself this question, and from each subspecialty, primarily prepare those 5 to 10 top topics which a postgraduate should know. Okay, I will be enlisting those topics, so you can always click pictures and make a note of them. Towards the end of the session, I'll be telling you about those topics also. The marking scheme is that correct marks will be given 4 marks, incorrect -1, and unattempted questions 0 marks. If you mark a question for review and if you don't finalize it, it will still be counted, whether correct or wrong. Any question which has been marked for review will be counted. The surgical group has their exam on 13th November in the afternoon shift. Now, this is the main focus of today's session regarding how to prepare and how can Marrow be of help to all of you. And this is an interactive session, so I'll be happy if you people post your queries in the chat box. I'll be happy to answer your question. For me, I think so. We have to go back to the basics, and that is the way to prepare. And National Board, instead of making you a master of one subspecialty, they want you to be the jack of all trades and know some portions of each subspecialty, with general surgery being the main thrust. And of course, the two main books which you need to focus on will be Bailey and the latest Substan, which has been released a few months back. These would be the two go-to books from which majority of the questions will be framed. Now, regarding Marrow initiatives, those who are a part of the Marrow SS group or those who are planning to join, the initiatives which we have taken, which will help you out during your preparation over the next 2.5 months. We have given anyone who is joining the super specialty course will also be given access to the Marrow Pearls and to the Marrow question bank, especially the surgery question bank. And how does this help you? This helps you because these pearls which have been made from Bailey and latest Substan. So a quick revision of these pearls will help you reinforce the general surgery aspects which are required for the exam. And you can revise these pearls while you're in your wards, while you're working. You can revise them anytime. So they will be a ready reckoner for you. And all you need to do to access these pearls, you need to click on the top, on the 3 lines which appear on the top left-hand corner of your screen. And you choose edition 5, and that's where you can access the pearls and the question bank. Now, the current Marrow surgery question bank has more than 1,000 questions which have been framed. Actually, the team has gone through each and every line of Bailey and have framed questions from that. And latest Substan questions are also being added. Okay, so these are 2 additions which are there. I would strongly urge you to use the Pearls and the Q bank, as they'll be very high yield for the NEET exam. The other initiatives which we are taking are that we are adding 2 national mocks before the exam. You'll have 2 national mocks, and each week there will be a 150 question test which will be based on Bailey and Substan. Each week this test is going to become live on the Marrow app, and you can appear for it. You will also be able to compare your performance vis-a-vis other students who are appearing for the exam. Now, I've asked the rest of the faculty to take Zoom sessions where they will be primarily focusing on those topics which you should know from the subspecialty aspect, which are required at the PG level. Okay, so these regular Zoom sessions, you will be informed, and these Zoom sessions will be open for all, not only those who are part of the Marrow app, but they'll be open for all. T&Ds regarding general topics and Substan updates, I'm already in the process of recording it. 3 of them have already been made live on the app, and in the coming week, few more will be made live. So we will cover up each and every aspect of Substan, and we will help you with that. Plus, we are starting with a dedicated YouTube channel for super specialty candidates where you can ask your queries. So if I were you, and this was the bomb which was dropped on me, my target would be that September end, I would want to revise Bailey again. And if you have access to the Marrow videos, I want you to watch my Marrow general surgery videos at 2x. Now, the Marrow general surgery videos, the videos which I have covered, they have end-to-end Bailey information. So Bailey has been completely covered, and this you can ask any student who's preparing for the NEET exam. Regarding the Substan updates, that I'm adding separately because adding them in the existing videos would make it slightly confusing. So in the form of tests and discussions, these important updates from Substan are being added separately. Plus, like I told you, the pearls are being updated with Substan updates. So do go through these points and that would be helpful. So September end, your target should be that you should revise Bailey. And one way to go about it is either read Bailey or you can watch the Marrow videos at 2x. My videos, there are around 60 modules which are there. You can easily watch them at 2x and finish them in 10 to 12 days. October should be when you should be revising Bailey, and this revision can happen with the tests which we've curated for you and the surgery Q bank. Plus the Substan update T&Ds you can start watching. Do attend all the Zoom sessions which will be organized, as they will be very high yielding for you. Subspecialty, these are the basic topics which we want you to focus. And like I told you, I asked a very simple question from each faculty member. The question was that which are the 5 to 10 topics which a postgraduate should know from that subspecialty. So from upper GI, the topics are achalasia, esophageal cancers, GERD, gastric cancer, GIST, and upper GI hemorrhage. These are the topics which any postgraduate should know. The management of cancers and management of upper GI hemorrhage is very important. You need to understand that the postgraduate exam, the NEET PG exam, primarily focuses on diagnosis, right, and investigations. But at the super specialty levels, questions will be more directed towards the management aspect. So for each one, you should be well versed with the management. And upper GI, it is good to read it from Substan. GI is good in Substan. You can utilize Substan, and that should be good enough information for your NEET exam. Lower GI, the topics are carcinoma colon, obstruction, familial adenomatous, polyposis coli syndrome, HNTCC, diverticulosis, centric ischemia. These are the ones which you should know about, in addition to lower GI hemorrhage from lower GI topics. Neurosurgery, the main thrust should be on neurotrauma, that is head trauma, and brain tumors. These would be the two main topics from which questions might be asked in the NEET exam. Head injury is very, very important. And for all trauma aspects, please read the ATLS manual. I have covered all the ATLS 10th edition updates in the Marrow videos, so you can go through those as well. Plastics and burns, wound healing, wound dressings. Burns, of course, is very important. Skin tumors, their management. Grafts and flaps, you definitely get questions from grafts and flaps. All the aspects regarding grafts and flaps you should know about. Cleft lip and cleft palate. Breast and head and neck reconstructive aspects, whether they're reconstructive aspects in the form of flaps or implants, you should know about these from plastic surgery. Urology, renal stones, all the cancers, so renal cancer, bladder cancer, prostate cancer, their management, their workup, you should know. Genetics is another component which is asked in the super specialty exam. So the genetics of cancers is extremely important. Then BPH management, all the aspects regarding TURP, these also you should be aware for your exam. Hypospadias, undescended testes, these are also topics which are asked commonly. From the hepatobiliary system, liver anatomy is very important. So you should know about liver anatomy. So liver anatomy you should know, and you should know about liver tumors and liver abscesses. These are from liver, from gallbladder. Gallstones are extremely important. CBD stones, gallstones. You should also know about gallbladder cancer. Pancreatic cancer and pancreatitis management is extremely important. Endocrine surgery. So endocrine surgery, breast surgery I've covered in great detail. And from the 150 questions, you should expect at least 15 or 10 to 15 odd questions to be from endocrine surgery. So listen to my videos regarding breast. Thyroid, definitely go through Schwartz. So for thyroid, Schwartz is very important. The question bank in the surgery module in MCQ, in the Marrow MCQ module for thyroid has predominantly been prepared from Schwartz. So do solve those questions as well. Okay. So these were some of the important topics. Any questions which you people have, please do write them in the chat box. I'll be happy to address your questions. There was one question which was posted earlier, that are the general surgery videos in the Marrow module sufficient for the NEET exam? Well, for the last 2-3 years, a lot of postgraduates have also been seeing my general surgery videos in Marrow, and they've not faced trouble attempting the general surgery part of the MCH exam. So Bailey has entirely been covered. So you can rely on the videos for Bailey. Substan updates, I've already told you, I'll be recording a series of tests and discussions where only Substan updates will be the focus. 2 of them are already live, and at least 4 to 5 more will become live in the next 7 to 10 days. Okay. Now, as I was saying, freshers versus old graduates. So I know there is a dilemma, especially those who have been preparing for a couple of years, whether to focus on NEET or to continue focusing on the Central Institute exams. Well, my advice here is that if you got a reasonable rank in a Central Institute exam, or if you had an interview call there but couldn't make it last time, my suggestion would be to primarily focus on the Central Institutes and try to crack them, because to change the strategy just 2 months before can be a bit dicey. But for fresh graduates, this is a great opportunity for all of you to crack the NEET exam. So you're all in the next 2 or 3 months, and some of you will be surprised that you can get a great rank in NEET and get the subspecialty of your choice. So Karthik is asking, I have all my UG notes which he had made after listening to my classes. Should I read those or see the new videos? So Karthik, my recommendation would be that you watch the new videos, because when you were a UG, now you're a postgrad, you finish your postgrad. So those UG notes were of very old edition, and a lot of changes have been made. So my advice would be to watch the Marrow videos at 2x. It will not take more than 9 or 10 days, even if you spend 6 hours, 5 to 6 hours every day. So watch the latest videos that would cover up entire Bailey and parts of Substan, and watch the TNDs which are Substan specific. Okay. Now, another question which was posted was that in Marrow, we are giving access to all the subspecialties rather than a single subspecialty. So the reasoning behind that was that you should be, a lot of postgraduates are also using the app, so they should have access to everything. Plus, now I think so with the new pattern, you need to know the basic topics of each subspecialty. You need to be the jack of all specialties now, jack of all trades. So you will have access to all the subspecialties also in Marrow app, and I've already listed out the important topics from each subspecialty, so you can watch them and you can have an edge over other people. The faculty members will also be recording a video regarding these important topics and the basic TND which you require for the general surgery NEET, for the NEET aspect. Any other questions? Also, we are in the process of starting a Facebook or a Telegram group. So whatever your preference is, you can write down in the chat box whether you want a Facebook group or a Telegram group where daily questions will be posted and all the Marrow faculties will be there, and you can easily access them and ask your doubts as well. Now, Marrow has already covered almost 350 hours of super specialty content is there. So it will be helpful. The filtered out content will be useful for the NEET exam. But those who are still preparing for the Central Institute exam, you can even go in depth and prepare that specialty. Yes, Mohammed, the videos are the same because they cover everything of Bailey. A lot of general surgery questions asked in your super specialty exam are from Bailey. In fact, the majority will be from there. And I've covered each and every aspect of 27th edition. The Substan updates I'm recording separately because the book came out recently. I'm recording them as separate T&Ds, which you will have access to. So you can listen to those specific T&Ds and get to know the Substan updates as well. Okay. Vanaja is asking, apart from gastro part, which chapters would you recommend reading for general Substan? So good question. So from Substan, I would strongly recommend that you read the wound healing part, the general aspects. Shock has given well. The chapter on shock is excellent in Substan. Definitely go through that. The newer modalities, that is MVOS, how to monitor MVOS. MVOS is increased in which shock, decreased in which shock. So all these have been explained beautifully in Substan. GIT, you should do from Substan. The subspecialty chapters given later on, you should definitely read them from Substan. Breast is given very well in Substan. For thyroid, I usually prefer Schwartz over Substan, but Substan also has given a good amount of information. Rohan is asking, Sahai sir, each topic-wise question expected from each super specialty. So there will be questions from each super specialty. The main focus will be general surgery, but the super specialty questions will be at the level of the PG exit exam. That means the level which they require from a third year postgraduate by the time they're finishing. Karthik is saying, what about Q-band? Is it segregated according to specialty or mixed one? And what about GTs? So the Q-band currently is has been arranged specialty and chapter wise in the Marrow Q-band. The GTs will be mixed GTs. They will be all specialty GTs. So they will be like your mock tests which you're doing with detailed explanation, and a lot of Substan updates will be covered there as well. The Q-band is is been segregated chapter wise. Look, Srinivas, Bailey, you have to read, barring trauma. Trauma, you should read from the ATLS manual. And so remove the ortho chapters and the trauma chapters of Bailey. Rest, Bailey, you need to read. If you have time, read it. If you don't have time, you watch my videos on 2x. They cover all the aspects of Bailey. For Substan updates, I doubt that you people will be able to read Substan now and then revise it. So you can rely on the T&Ds which we are creating. If you want to read, you definitely read the initial chapters on wound healing, burns, you read about shock, GIT, breast. These you should definitely read from Substan. There is one new chapter which has been added in this latest Substan, that is regarding fetal surgery, right? And you should definitely read that chapter on fetal surgery. There are certain advancements which have been mentioned there, which are potential questions for your exam. Rohan, they haven't highlighted what age will be there for each subspecialty. It will be a mixed bag, and you can be in for some surprises as well, where probably you'll this year you might have more question on plastic. Next year, you might have more questions from GI. So very difficult to predict what will be the weightage. Right, CTDS, the important topics regarding CTDS will be aneurysms, and that is aneurysms, dissection. These would be the main, and you should know the basic components about CABG and heart transplant. Substan, the vascular surgery system, is being given reasonably well, so you can read vascular from Substan. Bailey also has given very detailed vascular system. All 3 chapters, arterial, venous, and lymphatic, have been given very well in Bailey. So don't skip that. Anubhav is saying, in controversy, should we follow what Bailey says or we follow Substan? Well, I would say Bailey, but again, it is the examiner's wish what reference is he using. I would go with Bailey. Okay, Bhushan is saying, how do we prepare for next year NEET SS using Marrow? So next year NEET SS, your focus will be primarily on the general surgery components. So watch the videos. The videos will be updated after this exam based on what changes are there. QBank is already being added, so you do keep on doing the QBank. If you have a particular specialty in mind, do watch the specialty videos, because you have the Central Institute exams for which you can appear as well. Again, this webinar is primarily for the surgery group. Medicine, I'm sure Dr. Rakesh and his team will reach out to all of you and share the important topics which you should focus on. Ashika, if you're in second year and you want to prepare for NEET SS, my advice would just be to read standard textbooks right now. Don't go into too many MCQs. Read standard textbooks, build good concepts. That should be the way to go forward. Yes, one more thing which I want to highlight is recent advances. So recent advances, there is a separate book which comes out. Definitely go through those recent advancements and the trials which are there. Some bit of general surgery related trials will be asked in the exam. So you should know the basic trials also. And also 8th AJCCC classification for all the major cancers. 8th AJCCC classification changes which are there. This I've highlighted in my Marrow videos. You should definitely focus on those AJCCC changes, especially breast, head and neck, colorectal, lung, pancreas. These you should look at. Regarding Medicine SS, I guess Dr. Rakesh's video will be uploaded tomorrow, where he'll highlight how to go about preparing for it. Look, with 2 months to go, I doubt that you can read the textbooks cover to cover, provided, I mean, if you've read them previously, yes, you can. Substan is a new book which has come out, so it'll be very difficult for you to read cover to cover, so focus on important aspects. Bailey, you try to read if you get time. Dhaval is saying this year DNB 2018 batch is eligible because tenure ends in October 2021. Yes. So if your tenure ends by November, so they've written that if you are a recognized postgraduate or you get your provisional pass certificate or equivalent of recognized qualification by 30th November, then you are eligible for the exam. So Asma, whether one-liners or case scenarios, difficult to say, but because the pattern has been changed at a short duration with a short notice period, I think so more will be one-liners and core theoretical questions. There might be a few clinical scenarios which might focus on management aspect, but a lot of theoretical aspects will be asked. Mohammad, I've already enlisted the important topics of each subspecialty. What we'll do is we'll prepare a comprehensive list of these topics, and we will circulate the PDF. We will put it on one of the Marrow blogs, and you people can download it from there. So Karthik, recent advances, foreign or Indian author. What I would do is what I usually used to do was that I used to skim through the contents of both the foreign and the Indian author recent advances. And once I used to know the contents, then I used to decide where to read those topics from. So skim through the topics and then take a call whether you want to read it from that book, or if you read it from the textbook, that will be sufficient. Head and neck oncology. So Shraddha, you've asked a very good question. So those who are primarily preparing for head and neck oncology, you have to appear with the ENT group. Your exam will be with the ENT primary feeder, right? So your primary feeder specialty is ENT, and your exam is on 14th. And of course, with ENT being the primary specialty, you would need to read detailed ENT from their standard textbook, and also know some bit of general surgery aspects regarding head and neck surgery, know the reconstructive aspects from plastic surgery. So those would be the things which you would need to focus on. Rahul, AIMS SS pattern, I doubt that they haven't released any such notice. I doubt that AIMS or the Central Institute will change their pattern. So again, I think so a game changer, and you can discuss this with me after the exam. A game changer will be the Marrow Pearls. Marrow Pearls have been very thoroughly curated, where all the important tables from Substan and Bailey have been added, and they've covered all the recent advancements as well. So definitely access the Pearls. To access the Pearls, you need to go in the settings and move to edition 5, and you can access the surgery Pearls there, and revise them 2 or 3 times. It will be a ready reckoner for you as well for the exam. Yes, Vishnu, I've highlighted the general surgery, which I have covered, is more than enough as it covers entire Bailey. I have already started recording Substan update TNDs. 2 of them have been released. 3 to 4 more will be released in the next 7 to 10 days. So all the Substan updates I will cover in the form of TNDs, and the GTs which we are providing to you weekly will also cover them. So yes, to answer your question, the general surgery videos covered by me are sufficient for your SS exam. Of course, go through Substan, it will be helpful in residency. So, especially those who've been preparing for a subspecialty based exam for the last few years, it's a very difficult call which you need to take, whether to continue preparing for the central institutes and laying more stress on the specialty aspects, or change course and start reading more general surgery comp and focus on NEET. So yeah, it's a difficult call, but you need to take it quickly and then streamline your preparation. One of the reasons that because they were seeing that a lot of seats were going vacant, and with this, one person gets access to all the subspecialties. So those people who are not very inclined on doing one only, or have 2 or 3 specialties in mind, this exam will be beneficial for you. Amit Medicine, Dr. Rakesh is going to release a video which will be updated tomorrow. For surgical gastroenterology, Sebastian. General. So Vishnu, the general surgery videos, QBank is the same, but if you have access to the SS part, you will not have access to the weekly SS. You will not have access to these weekly tests which we are organizing, which are based on Bailey and Sebastian updates. And the tests and discussions, which will be Sebastian specific, which my new videos are coming out, you will not have access to them if you don't have access to the SS app. Right. So I think so I've answered most of the questions that you people have asked. I know it was a shocker for everyone, but it is time to refocus, replan, and then to execute that plan over the next 2 to 2.5 months. All of us are there to help you out. If you have any queries, you can always reach out to me on my Instagram ID, that is left-handed surgeon, or you can send me an email on rohankhandelwal@gmail.com. I will reply back. Marrow is going to create a dedicated YouTube channel for super specialties and a Facebook or Telegram group. You will be intimated, and this will be free for all, so you can ask your queries there as well. But I think so. It's time that we look at change and pattern as an opportunity and try to make the most out of it. So Karthik, if you take access to the Marrow SS surgery plan, you will automatically get access to the QBank and the Pearls as well. We are giving a 3-month access to the QBank and the Pearls. For that, you need to take the super specialty surgery access. All right. Thank you, everyone. If you have any further questions, you can message me on my Instagram ID or just drop a comment below this video and I'll reply back to your queries. The important top list, we will make that list and we will put it up at a place and we'll share the link in the comment section. You can download the important topics from there. All the best. Thank you.